Jones. My name is Cassie Meyer and I'm a nursing student at the University of South Alabama, and today I'm going to be performing tracheostomy care on you today. So the first thing I'm going to check for is any allergies, and I see he has an allergy on his order form for penicillin. So I'm Mr. Jones. Do you have any other allergies? No, you don't? Okay, great. Next thing I'm going to verbalize is that my trash can is here, and I'm going to tell Mr. Jones that I have privacy in the room. So the first thing I'm going to do is check for an actual order on his order form, and I see that there's an order for tracheostomy suctioning, so we're going to go ahead and get started on that. So the first thing I'm going to do is perform hand hygiene. And now I'm going to check your wristband and compare it to my order form. And I see Jaguar J. Jones is your name on here, and Jaguar J. Jones is also on my order form. The MR number is 417-6352, and 417-6352 is also on my order form. I also see that you have an allergy to penicillin on your wristband, and I also have that written down as well. Next thing I'm going to do is check the saline bottle, see if it's expired, and it's not. I'm also going to gather my supplies and make sure it's all here, and it is. So now I'm going to raise your bed and lower the side rails and position you to either a high Fowler's or a semi-Fowler's position, and I'm going to don my PPE starting with my gown. Okay, so now I'm going to gown, mask, goggles, gloves. Okay, for the purpose of this checkoff, I'm going to take off my mask, but I know during normal hospital settings, I would not actually take off my mask. Okay, now I'm going to tell you about the respiratory assessment that was already performed on him. So the things that were found that indicate that he needs tracheostomy care is abnormal respiratory rate and adventitious lung sounds, and there was also inefficient clearing of the mouth passageway when he coughed, and there was drooling and nasal secretions as well. And when I checked his vital signs, there were a decreased pulse oximetry and increased respiratory rate. No, I'm sorry. Increased hypertension and increased respiratory rate and increased blood pressure. And then there was also confusion and dizziness, and if it gets bad enough, it can lead to cyanosis, and there was also changes of pallor. And I'm also going to be able to check his pulse oximetry rate by putting this on his finger and keeping on there throughout the remainder of the procedure. Okay, so now I'm going to go ahead and get everything ready. So I'm going to drape this towel over you, Mr. Jones. And I'm going to move this. I'm going to get ready to open my sterile field, or sterile area. And I think that's everything. I guess what I'm going to do prior, though, no, not prior, okay, yes, okay. So I'm going to take off first I need to open my sterile field, only touching the 1-inch border. Okay, and now I'm going to take off my gloves, my clean gloves. And throw them away, and I'm going to don my sterile gloves. So now I'm maintaining sterility and throwing this away. And I'm also going to take out my saline bottle and open it, cap up. I'm going to take out my catheter, my suction catheter. And I'm going to throw this away as well. And I know that my table may not be at waist level, but so I know I'm breaking sterility. So now I have my catheter sterile, and I'm going to attach it to my suctioning tube. And yes, okay, so I forgot to tell you earlier that I'm going to use my, so I'm going to make sure that the suctioning tube is at a 100% oxygen flow rate, and I'm also going to let you know that my pressure for my suctioning tube is at 100 to 150 millimeters of mercury, not exceeding 180 millimeters of mercury. Okay, so now the first thing I'm going to do is make sure this is working. So I'm going to suction a little bit of saline, and it is working. And next thing I'm going to do is take off my patient's oxygen therapy and hyperoxygenate my patient using 5 to 6 squeezes of the Ambu bag over 30 seconds. Okay, now what I'm going to do is put in my sterile catheter and without touching anything, and I'm going to gently place it in without touching the outside of the cannula, and I'm going to push it down until my patient starts coughing or until I hit resistance. So I just hit resistance, so I'm going to pull back a centimeter, and then I'm going to begin intermittent suctioning with my non-dominant hand and moving my catheter back and forth. And this is supposed to last 15 seconds. Okay, now I'm taking that out. I'm going to clear this, and I'm going to hyperventilate my patient. 1, 2, 3, 4, 5, 6, and now I'm going to encourage my patient to cough. And one reason I would stop suctioning is if my patient's pulse rate, the beats per minute, dropped or increased 20 beats per minute. And I would also quit if his oxygen rate dropped below 90% or 5% below the baseline. And I've already hyperoxygenated and encouraged him to cough, and so I'm going to repeat this process one more time during this video. And going until I hit resistance without contaminating. And I've hit resistance, so I'm going to pull back 1 centimeter and go ahead and begin sectioning intermittently and pulling my catheter back and forth until it is out. Now it is. Okay, so now what I'm going to do is take this off, hyperventilate my patient, and normally I would continue suctioning if my patient needed it more, but for the purpose of this video, I'm only going to do it twice. Now I'm going to take this off, and I'm going to reapply the oxygen, and I'm going to throw this away. And skin to skin. And now I'm going to perform hand hygiene and put on my clean gloves for the rest of the checkoff, for the rest of the respiratory assessment and tracheostomy care. These are just my clean gloves.